understanding the importance of global health and how you and your family have engaged in conversation around this, and also about your church too.
Sure. Well, global health has been important in my ministry probably past 5 or 6 years, just through some mission engagement. We've served both missionally in Haiti, in Trinidad, and in Guatemala. So I've seen the effects of the need for global health beyond the Indiana area. So probably back in 2011, when I was serving at Summitville United Methodist Church, North Central District, we started collecting for Imagine No Malaria. So probably in my ministry there, we collected a couple $1,000 maybe, a couple hundred nets as we just began to think beyond the walls of who we were. And then so that's just kind of spiraled as I've done more mission engagement, and then now with this offering. So we're kind of doing that as well.
Awesome. Very good. So as you think about it, what's really important to communicate to our members? Those people who come every Sunday to church and look at the mission field that's around them, and we see, definitely there's so many priorities in just our local context. Why is it also important for us to look a little bit further?
Sure. Well, we're working on a vision statement for our church right now, so we don't have these sayings that we can just throw out. But we're trying to look beyond the walls of our church. So both locally in our community here in Lebanon, as well as around the world, how do we engage both those folks who are hungry here, but those who need something beyond here, whether it's beyond our city, beyond our state. And so we're kind of taking that approach, and that's part of the education process, it's part of the vision process we're looking at. How do we serve as a church, both here, where we're planning, and just around the world?
Yeah, I think, for me, growing up as, a super Methodist nerd in some places, I would say, is one of the things that I was so enlightened about as I grew up in the church and got to know more about who we are as United Methodists, and I still feel so connected to, is that our church exists here in a community, but we're connected to so many other churches in a district, in a conference, and then a jurisdiction, and then around the world. And so really our community extends from Lebanon, Indiana to Harare, Zimbabwe, and to places in Germany and well beyond. So it's just exciting to think about all that can happen by the mighty power of a connection. And that's really also what's happening with the efforts around both Imagine No Malaria and also the Global AIDS Fund. Through the work of Imagine No Malaria, we've seen that this reduction through not just us as Methodists, but through a global partnership from people dying every 30 seconds to
once every 2 minutes, right?
Exactly. So that's a huge reduction. So how do we continue to share that message, but then also the work of the Global AIDS Fund as well? So what are some of the things that you all have done or are doing to build awareness around?
Sure. Well, we are collecting right now for this fund through our ministry offering known as our One Thing. It's something that we've borrowed from Alex Hershey. Thanks, Alex. And I think Alex borrowed it from Adam Weber. So thanks, Adam. We'll throw that out there. But so for this month, instead of just having one day of a collection, for the entire month, we're receiving an offering for this fund. On the first day that I introduced it, on our first Sunday, May 7th, I showed a bed net. I received this bed net probably 4 years ago from a different malaria partner. And so we talked about the importance of a bed net. I actually held it up. I actually put it over me just to kind of show it, because that's just how I am. But then for the whole month, we're receiving this offering. So that resource has showed up as we're doing this. And then we're just collecting ongoing. So I think for us as a church right now, we've received around $500, both in money in hand and pledges for this offering, with still 2 weeks to go. So I'm excited. That's 50 lives.
Yeah.
That's 50 lives.
And every lives matter in this. So talk to us a little bit about the importance of the bed net, and why is that a thing? And,
the bed net itself.
Yes.
I mean, it's been a tangible witness of what we're doing. So with the funds, I mean, oftentimes we receive offerings, but we don't see what it does. So it's actually shown both the kids, my own kids, the kids of the church, those who aren't kids at our church, what they're purchasing. I've even held it up to the point that you can see how it drapes over the bed, how the tie straps work, of how you can protect yourself. And then just to give the witness of how this would protect a family. And this one, of course, it's not insecticide treated, so we're not dealing with that, but we just kind of show the element. But yeah, so that's our biggest resource we've been using to promote this.
That's awesome. And so, Imagine No Malaria really was derived out of what was the Nothing But Nets campaign. And so when we learned of the great need that really engage around the lives that are being lost from malaria daily. We in America haven't really dealt with malaria as a thing since, I think maybe the early 50s or beyond, or even further in. But imagine if you could just save your family, your child, yourself, your wife, your husband, by just sleeping under a net. And that was it. So.
Right. And that's what's made it real for me. My wife and I, we have 5 kids. The statistics of 1 child every 30 seconds to, now 1 every 2 minutes. That's real for us. We have 5 kids. What would it be like if we were not here in Indiana with 5 kids? How would we keep them safe at night, or could we?
Very much so, very much so. And, to just think about, there are just so many different things. The first thing is, protecting you. And the next thing is, for finding treatment when you have malaria. I think I've shared this several times throughout, this offering awareness, is that my grandmother had malaria as a child. Obviously, she lived because, I'm here. But in America, even in the 1930s, you would live, but that's not a thing that's certain for everyone in sub-Saharan Africa. So us providing just that $10 amount can change a life, can transform it, and provide something that sustains them for many years to come. So what else do you think churches can do as they think about how to share this message in the context of their church community or the larger community?
Part of it's biblical. When we turn to the scriptures, I brought a Bible with me. Imagine
you have
that,
a Bible.
A Bible in the church.
Oh my goodness.
One of the scriptures I've used in the past, Psalm 91, and especially with malaria. The words of the psalmist says that God will cover you with his feathers. Under his wings you will find refuge. You will not fear the terror of the nights, nor the pestilence that stalks in the darkness. The scripture even provides assurance that God will be there. Perhaps God is there just through a net. So we begin to tell the story, it's not just global health, it's not just humanitarian, it's faith, it's life. And so drawing that connection, kind of just engaging our kids, whether it's been our children's message in a corporate worship setting, or just conversations outside of worship of why it matters. It's been a lot of what I've been doing for this effort over the last 2 weeks.
Awesome. Yeah, I think it's also really important too as we continue to think about what it means to answer the call of ministry. Everyone's called, and we're all called to different things, and we all have different interests, and I think we can live those out. Some of us are really engaged in providing ministries in the local context, and some of us have passions that draw us to other places of the world, but there's space for us all to have an impact. And it's important that we all know about the local context and also our global context. So this is really a wonderful opportunity for us in Indiana to really look at what it means to be in partnership throughout the connection, and what it also means to be missional in a new way. So,
well, and a part of this offering is local, right? When the AIDS portion, is it 50% or 25%?
25% stays in the
Indiana
conference that it raised from. So think about the AIDS crisis in southern Indiana 2 years ago, and how much that shook the community there, and even communities around the state, to think about and how do we build awareness? We had a really great chat last week with Dr. Jen Walthall, who serves as the Secretary of Family and Social Security Services, who's also a Deputy Health Commissioner at the time, to really talk about what the partnership between government and nonprofits and faith communities, how it was so important that they were all working in tandem together to build awareness for each person that lives in that community, and how do they also serve persons who are impacted by that outbreak at there. So dollars like that stay here help us be able to address things locally. And how do we continue the conversation to end something that's so preventable?
Sure.
So it really is a great thing. So I'm gonna like pivot here and see, kind of, I know I have a phone, like I'm gonna admit I'm using an LG phone and I don't know how to turn it on because I'm so iPhone today. I tried that. Oh look, that does work if you hit the back. Thank you, camera guy. Now let's see how this works. I don't know. Nope, that's not it. Somebody open it for me, how about that? You know, yes, there are things that I'm technologically not able to do. Unlock an LG phone is one of them. So I just got, our first question is, where can my local church get a net? Where can they get a net?
Well, this net, I actually got it through World Vision back in 2012. I don't know if they still have them, but that's the site I went to. So we used their resources as the United Methodist Church used it, but still we all partnered together as the church. So that's where our net came from.
Yes.
I don't know if you know of any of the resources.
ImagineMalaria.org probably also has some resources that you can do. I'm sure also there's that wonderful thing called Amazon, and it has everything. Yeah,
you could probably even go to like a craft store.
Yeah.
This looks a lot like Tool when you look in close at it. I mean, just for visual purposes, you could probably just use Craft Tool if you're trying to display.
Yeah, pretty much. I mean, there's so many different things. I even think maybe sporting stores probably, like a Dick's or a local sporting store would have things that you could use to tell that story as well. There are also some really other great resources available too to visualize what it means and to explore and build awareness around Imagine No Malaria through the Imagine No Malaria resources on their website, or also inumc.org/global health. Let's see what else we got. Wouldn't it be best to give $10 and buy the net locally? Well, yes, you could buy a net locally and send it. However, your $10 does much more than just provide a net. So Imagine No Malaria is a initiative of the United Methodist Church that is partnered through United Methodist Communications, the General Board of Church and Society, and also the General Board of Global Ministries. And those organizations have amazing networks in sub-Saharan Africa through our conferences and also our United Methodist Health Clinics that are all throughout sub-Saharan Africa, they have experience and knowledge and know-how to do the education resources and work that happens on a daily basis, the testing and training and treatment for people who have malaria, and also providing that. So $10 is not simply providing a net, it's providing everything else in between, from the education point to treatment point. And so yeah, we could do what we have done before is send those nets, but also identifying the people who need them the most is something that is best done locally.
When I remember a story, it's in the New York Times, I think, probably January 2016, it talked about bed nets. And with what the United Methodist Church does, it's the education process, because the bed nets were used for fishing, and it was killing every little fish because there wasn't the education.
Yeah.
So beyond just the purchase of the nets, we're also purchasing time or resources or energy to teach people how to properly use the nets. So it's not only malaria prevention, but it's also We're not killing the fish, the rivers, the streams, just for life to exist.
Yeah, very much so. Very much so. So exactly, that's right. Providing everyone with a tool that they may not know completely how to use or why to use it isn't always not best. But connecting them with the resources that can help, explain the importance of why this is needed is great. Our next question is, what role are local African churches taking in Imagine No Malaria and also global AIDS or AIDS and HIV education? So I would say that you would be very surprised at how engaged our local churches in Africa are in providing education and resources about health to their communities. Because of the amazing connection that is United Methodism and our boards and agencies and also our conferences around the globe who have invested time and resources and energy into partnering to build community health centers and also educate people as trainers. It's amazing that I think that some of those people probably could come and almost be, working clinics here because they have so much information on how to educate people about HIV/AIDS and also malaria. And even more recently, in the past few years, what was the Ebola crisis in West Africa? So that was another place where the United Methodist Church had a significant impact in reducing the amount of lives that were lost because we had networks and health centers that were there in place and we already had an infrastructure to deal with some of those things. So local churches are doing their part there as well to end this crisis. But again, it's about a global partnership for us to be in community with each other, right?
Well, that's the annual conference theme, right? Yeah. Together we are more.
Together we are more.
Together we're more.
Yes,
yeah.
Exactly.
Check that out.
How do you, it's about, hand in hand, working together, right?
Yes, sir.
So let's see, what else we got? We are hopping with some questions here today. Imagine No Malaria makes a great VBS mission project. I did not know that. I don't know who that came from, but thanks for sharing that. I'm assuming we can find that on their the Imagine No Malaria website. Awesome. Very good. Let's see if we got anything else coming up. Okay, awesome, great. It looks as if we are good. Anthony, what's your what would be your takeaway to tell everybody about as you go to conference? What are you looking for about this or any aspect?
For this event? I mean, especially with the theme. If we go with Together We Are More, in the midst of our divisiveness, sometimes it shows up. I mean, efforts like this, it's so simple, but yet it changes lives. And that's what I'm about. I'm missional. I want to get beyond the walls of the church, see lives changed. Sometimes it takes a health change, maybe to bring about the message of Jesus. So that's what I'm excited about. So I hope our local churches will all support this. It'll be a good miracle offering at annual conference.
Yes, sir. I'm excited about it as well. I think, again, this is a wonderful opportunity for us to focus on being in community with each other and working towards a common goal, but also helping others around the world to really live to the highest of their God-given potential, to live full lives, and for parents not to worry about losing their children to things that are preventable, or to provide children the aspect of, it might happen, but there is a tomorrow. So this is just a great moment for us in Indiana, and it's a great moment for us as a denomination. So we're really excited about the Indiana Miracle Offering for Global Health and what it can do to help end malaria through the Imagine No Malaria campaign, and also the United Methodist Global AIDS Fund. So thank you all for joining us. Thank you, Anthony, for sharing some time with us, and looking forward to seeing you at conference.
Yes, sir.
All righty. Bye.